This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations.
The benefits of teledentistry. In this video, we will discuss the benefits of teledentistry and how it helps patients and dental providers. Common teledentistry modalities include live video consultation, store and forward, and remote patient monitoring. Each of these modalities support the delivery of dental care, including risk assessment, oral exams, using photos and videos, motivational interviewing, and self-management goal setting. Teledentistry services may even allow dentists to supervise patient-administered care, such as fluoride varnish application, and emergency care triage from a remote location anywhere in the world. Many pioneers have demonstrated that teledentistry is an effective way for dental professionals to connect with patients virtually. The advancement of teledentistry can increase access to oral health care in underserved and disadvantaged communities.
My name is Dr. Robin Hogan. I practice at One Health in Miles City, Montana, and I've been a part of the federally qualified healthcare system for 2 years.
My name is Katie Adams, and I am the operations manager for the dental department at the One Health Center as well.
We have used it for a variety of different ways. One of the most notable was to be able to see limited exams when I was at home with COVID. And that was super helpful to be able to diagnose, get patients where they needed to get the treatment they needed at that time. We've also used it for nutritional counseling and oral hygiene instruction. One case in particular was a little one who didn't want to come into the office and just wasn't quite prepared to do so. So we were able to meet with that family at their home virtually. We've also used it for post-op reevaluations, which has been helpful too, especially for some of those folks that don't live super close to Miles City. We draw from about a 2-hour radius, so it's been helpful for those that live out of the area as well. Personally, I'm really excited for teledentistry. It was an amazing opportunity to be able to help those few patients when I was home with COVID, to be able to get their care started, to be able to use that teledentistry visit as our initial opportunity to gather information and then to make that personal relationship. Because when he came back yesterday, we already had a rapport established, and it was he was delighted to be able to see me and to see our team members that he had previously met. So it was a really wonderful exchange, and I loved the fact that I had gotten to meet him previously. So if we're able to get to them before they develop a significant facial abscess and just get them an antibiotic and then schedule them out, whenever our schedule allows for the final treatment, it would just be such a savings financially and time-wise and loss of work, all those things to keep people healthier, to keep people out of the hospital. If teledentistry, I believe, was utilized more, it might be something where we could potentially see more patients per hour, because we can at least just get the initial diagnosis and reschedule. That would be an opportunity. Or B, if the ER was able to connect with us right away and say they called and said, we have this patient here with swelling, we might be able to identify that need as more urgent and get them in sooner. But clearly, if we can just get them an antibiotic or identify those that are having a significant issue before they go septic, I think we'd all be better off.
I'm Yogita Thakur. I'm a pediatric dentist by training, and I am the Chief Dental Officer at Ravenswood Family Health Center. We're a FQHC in East Palo Alto, California. We first started teledentistry about 10 years ago now through a pilot project with the Pacific School of Dentistry and Paul Glassman. And we started with the pilot implementation of the virtual dental home. Virtual dental home connects communities outside of the 4 walls of the dental clinic to the dentist via a dental navigator and a dental hygienist. In that program, a dental hygienist goes out into the community setting, which could be a preschool, a senior housing center, assisted living, any kind of facility outside of the four walls of the clinic. And there they collect patient records, which are photographs and x-rays, and do a cleaning and fluoride varnish applications on site. The records of the visit are collected and uploaded to our electronic health record, which I then review and make an appropriate treatment plan. We focused on children 0 to 5, as our project was also funded through First 5 at San Mateo County. And we worked with Head Start and Early Head Start in our county. That's the first experience we had with teledentistry, and we really it was a very successful project. We made real great connections and inroads both with schools and families, and we've had that program going now for 10 years. With the pandemic 2 years ago, we had to pivot very quickly to figure out how we could serve our patients, even though we were closed in the beginning during shelter in place, and then trying to figure out how to provide care safely. So with the knowledge we had from our virtual dental home implementation, we knew that a dentist can diagnose fairly accurately by looking at photographs and getting a good history. The only thing in the new pandemic missing was that I did not have the hygienist on the other end. But if the patient had been a patient of the clinic before, if we had recent x-rays, if they were already established and they had recent x-rays, getting a good history over the phone, asking them to take some pictures, helped us make a diagnosis and figured out if they really needed to be seen, or the care could be deferred, or they needed antibiotics or treatment prior to be being seen in the clinic, so that when they actually did come to the clinic, they were actually being seen for the surgical part of dentistry, if you will.
My name is Ramona English, and I am the Chief Dental Officer and one of the dentists working at Paraluma Health Center. We started using teledentistry during the pandemic, and we just love innovation and quality improvement. Our organization just thrives through innovation and quality improvement, and we were able to use principles of quality improvement in designing like the new teledentistry program. And it's really, so we try different models and different applications for it. So over time we learned that we can use teledentistry to increase access to emergency care, to increase access even to well care for younger patients. We can use teledentistry for screening patients, for establishing care for new patients. So we found different applications. Of course, we always have the medical side. They've been providing telehealth services, and we are using them as an example, and then our own experience from our internal workflows, just trying to see which ones really translate well to a virtual visit for patients.
Studies on the use of telehealth services have shown that most patients are comfortable communicating with their healthcare providers via text, email, or video, and will prioritize access to remote care over seeing a provider in person when possible. With modern forms of communication, patients' needs and preferences should be taken into account when offering services via teledentistry. They may be more likely to seek out dental care if there is less friction to receiving those services. In summary, teledentistry is defined as delivering dental care via telehealth information technology and methodologies, largely to connect dentists with remote patients. You can probably already see why teledentistry is a rapidly growing tool in oral health care delivery. It can be used to reduce disparities in oral health outcomes among underserved communities, to improve efficiency of operations and improve coverage for existing patients. Investments in telehealth as a whole are expected to reach $64 billion by 2025. And as a branch of telehealth, teledentistry is set to grow dramatically over the next few years. By applying either synchronous or real-time interactions in asynchronous or store and forward methods to support existing services, any dental practice can start using teledentistry today.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.